Hello class, my name is Safari Sekioba. This is genetic case presentation of thalassemia disorder. These are the objectives that the learner will be able to accomplish at the end of the presentation. Basically, it is saying that the learner will be able to provide a concise definition of thalassemia disorder. The learner will be able to clearly describe the clinical presentation associated with thalassemia disorder. The learner will be able to distinguish between the type of thalassemia disorder. The learner will verbalize workup and family counseling need for patients with thalassemia disorders. Thalassemia disorder was first discovered in population near Mediterranean Sea. It is a genetically inherited disease, an autosomal recessive congenital disorder that causes disturbances in hemoglobin generation. It reduces the globin chain that are available for oxygen transportation. That is why patients with this type of disorders sometimes present with shortness of breath as their chief complaint. Type of thalassemia disorder that exist include beta thalassemia and alpha thalassemia disorders. Beta thalassemia, it is a shortage in quantity of beta globin chain. It results from multiple mutation in beta globin chain. It contains excess of alpha globin chain, and it is composed of two subcategories as well. And these categories are beta thalassemia minor and beta thalassemia major. Beta thalassemia major, it is a missing of two copies of chromosomes. Symptoms are present since birth. The carrier will carry information from both parents, the mom and the dad, and the damage are both done on both genes. In comparison to beta thalassemia minor, sometimes it is so minor that the symptoms are unavailable and that there is no medical management needed. The mutation involved one single copy of chromosome number 11, and there is a presence of anemia which may be present or may not be present, and it is referred to as a heterozygous genetic disorder. In terms of thalassemia alpha disorders, basically there is a defect of alpha globin chain, and there is a collection of inherited anemia with sets of clinical severity. It contains excess of beta chain, and it is made of two subcategories as well, and these include hemoglobin Bart's hydrops fetalis syndrome and hemoglobin H disease. Hemoglobin Bart's syndrome, this is the most severe alpha thalassemia. It has fluid accumulation in more than two compartments of the body. Fluid accumulation start before birth, and there are 3 out of 4 alpha chain that are removed. A complication of this type of thalassemia disorder include preeclampsia, preterm delivery, unusual bleeding, and much more. This type of alpha thalassemia disorder, it is so severe that people with this type of disorder, they don't make it to life. On the other hand, hemoglobin H disease, it is less severe than Bart's syndrome. It has mild to moderate anemia. It is a single gene for alpha globin working. It causes severe complication at times as well. It is referred to as microcytic and hypochromic hemolytic anemia. So my case scenario is about an 85 years old African American male who migrated to the United States at the age of 50 from Egypt. He was a professional athlete for his entire life, and with no history of health complication whatsoever. The only history he had, it was a multiple surgery that he had here in the United States, and because of such he had also a transfusion, but those transfusion happened only 3 out of 6 time that he had a surgical procedure that he was healed. And he was a unique patient. He recovered always well after all his procedure, and it was at the end that he was made aware to all of the nursing staff that the uniqueness of Mr. JS, who was my patient, was because he had thalassemia beta minor. So clinical presentation of thalassemia may range from mild to severe, again depend on which type of thalassemia disorder that one has. Thalassemia major, of course, has more symptoms, and these symptoms include fussiness, pettiness, jaundice, and much more. In comparison to thalassemia minor, symptoms may include mild sign of anemia or no symptom at all. Symptoms of Bart syndrome include heart failure, brain retardation, hydrocephalus, and much more. Remember, this is the most severe type of thalassemia disorder that ever existed. And as I stated earlier, people with this type of disorder, they don't make it to life, some of them. And this is why my patient, Mr. JS, did not have any symptom because he had a thalassemia beta minor, which sometimes show symptom or sometimes it doesn't. So clinical symptom for thalassemia H include hemolytic anemia, aplastic anemia, splenomegaly, or hypersplenism. The diagnosis and testing that involved into thalassemia disease, it include a complete blood count and hemoglobin testing, reticulocyte count, iron, and genetic testing. Genetic testing that might include prenatal screening such as chorionic virus sampling and amniocentesis. Of course, for my patient, Mr. JS did not have any of the above, except he was diagnosed for his condition at three different occasions when he had CBC collected from him. And at those 3 different occasions, his level of hemoglobin was always stabilized at 9 milligrams per deciliter of blood. So the disease comorbidity, per definition, basically it is the communication among the sicknesses. It happens when there are 2 disorders or more illnesses that happens at once or at the same time. It depends on the type of the disorder that somebody has or that someone has. In type of thalassemias, thalassemia major has the highest comorbidity because sometimes it involved the failing of more than one organ. Mr. JS did not exhibit any of the comorbidity because again he had thalassemia minor, which sometimes show or it doesn't show symptom of complication from thalassemia disorder. So when it comes to treatment plan, there are several options, and the most common option we have are blood transfusion. Blood transfusion is done to restore healthy red blood cell because in thalassemia disorder there is not only a destruction of red blood, but also there is a misshape of a red blood cell. So transfusion is done basically to restore the healthy blood cell. And the next treatment, it is a ion chelation therapy. This is done to correct the ion overload from blood transfusion. Again, this will depend on the type of thalassemia disorder that one person may have, because those persons who have a severe thalassemia disorder may have may have several transfusions, which in result may cause iron overload. And then the next type of treatment that is available, it is folic acid supplement. This is done most of the time in people with beta thalassemia minor, because basically it's a supplementation, and it is done to build healthy red blood cell as well. Sometimes also it is done to slow the rapid destruction of red blood cell. Mr. J.S., of course, he was transfused at 3 different occasions, and out of those 3 different occasions, his blood level of hemoglobin has always never rise above 10 milligram or 10 milligram per deciliter of blood, because again his uniqueness of being a thalassemia minor patient. Genetic counseling. In terms of genetic counseling, it is strongly recommended that individual with a family history of thalassemia disorder seek counseling, and this must be a culturally sensitive genetic counseling that's supposed to be provided, and it should focus on reproductive issues to be provided by a licensed personnel from the American Board of Genetic Counseling. Again, Mr. J.S. was from a third world country, and none of these services was available to him. And these are my references. I want to thank you so much for listening, and basically this is the end.